So here the PowerPoint overview about calculation of medication and intravenous doses. First of all, medication administration. So drug measurement system, the unit we use gram, liter, meter, or centimeter. So gram are the unit for any solute, like 10 gram sugar. It is a solute, right? And solute is dissolved in a liquid and make a solution, like 10 gram sugar dissolved in 1 liter water. So 1 liter is the unit of liquid. So to measure any length, we use the meter or centimeter. So in this short discussion, I am trying to figure out what are the different unit. Gram for the solute, liter for the liquid, and meter for the length. The matrix unit or system, the basic unit of matrix measurement are meter, liter, and gram. But meter for the length, liter for the liquid, and gram for the solute. And what next here? Also, what are the different household measurement system? Household measurement system, we use the dram, grain, right? But are not commonly used in the clinical setting. Commonly used the household measure, including drops, like eye drops, teaspoon, tablespoon. So small spoon we call teaspoon, or big one is called tablespoon. We use the ounce, like 1 ounce apple juice. 1 ounce equal to 30 ml. Or cup, 1 cup orange juice means 240 ml orange juice. So in NCLEX board exam, sometime asking some dose calculation, that times we have to know the basic unit. So conversion tab to be memorized. Here some of the conversion we left, you have to remember for board exam. So at least what you need to know: 1 liter equal to 1000 milliliter. So 1 liter, if you want to convert to milliliter, we have to multiply by 1000. What others? Like 1 milligram equal to 1000 microgram, smallest one. 1 gram equal to 1000 milligram, and 1 kilogram equal to 1000 gram. What about the length? 1 inch is equal to 2.5 centimeter. Different household measure. like 1 kilogram equal to 2.2 pounds. So in NCLEX board, when you found any patient body weight mentioning in pound, you must convert it to kilogram. So when pound convert to kilogram, it will be divided by 2.2, right? Because a smaller unit will convert to bigger unit. What does it mean? 1% solution, 25% solution, and 100%. 1% solution means 1 gram solute per 100 ml liquid. 25% means 25 gram per 100 ml. 100% solution means 100 gram per 100 ml. Here's some unit about the liquid. Like 1 cc equal to 1 ml. It is same. And 1 ml milliliter equal to 60 micro drops, means small drops. But 1 ml equal to 15 macro drops, bigger one, shortly called GTT. I'm just mentioning which one you must need to know for board exam, which one is minimum, right? Here we say 1 teaspoon equal to 5 ml, but 1 big tablespoon equal to 15 ml. 1 ounce equal to 30 ml. 1 cup equal to 240 ml. Example, my patient took 1 liter water, 1 ounce orange juice, and 1 cup apple juice. How much total input? In NCLEX board, if you get, my patient took 1 liter water, 1 ounce orange juice, and 1 cup apple juice. What are the total amount of fluid intake? So 1 liter equal to 1000 ml, 1 ounce orange juice equal to 30 ml, and 1 cup carrot juice equal to 240 ml. So all together, 1000 plus 30 plus 240, 1270 ml is total input. So every healthy individual person, total amount of input must be equal to the total amount of output. We call input and output chart. So we have to maintain it clearly. So what next? Here showing the drop factor, micro drops and macro drops. So you see the picture here, right? These are 1 drops, and here bigger drops, and these are small and smallest. So drop factor means the drop factor is the number of dropper per ml. Depends on size of the opening of the drip chamber. Like this is the size. Drop factor is indicated on IV tubing package and varies from the company to another company. Here is the showing three size of macro drops, right? And as I'm mentioning here, 1 ml equal to 60 micro and 1 ml equal to 15 GTT or macro drops. Micro drops chamber deliver the 60 drops per ml like this. Most electronic pump rate are set by ml per hour. So this is the eye drops and this is the macro drops. So sometimes we say we use ounce, you see ounce and cup. So in this picture, this is the ounce measurement cup and this is the cup we use, right? Dose measuring cups, and this is the small tablespoon, teaspoon here, and this is the bigger tablespoon. So 1 tablespoon equal to 15 ml, but 1 small teaspoon equal to 5 ml. What next? Here showing additional common drugs measurement. We use the milliequivalent. This is the one unit we use. Like example, blood pressure. 120 is a systole, 80 is a diastole. So systole over diastole. But what are the unit? Millimeter of mercury. This is the constant unit for blood pressure. Same as another unit we use called milliequivalent. So example, milliequivalent is an expression of the number of grams of a medication contained in 1 ml of solution. For example, the measurement of potassium is given in milliequivalent, such as 5 milliequivalent of potassium, right? So like your patient has a hypokalemia, you need to give 5 milliequivalent of potassium as prescribed. Another unit we use, it is called unit. Measurement a medication in terms of its action rather than its physical weight. Like penicillin, heparin, insulin. So 1 unit insulin, 2 unit insulin, 2 unit heparin, 1 unit penicillin. So unit is their unit, easily way. Like milliequivalent is unit for potassium measurement. Millimeter of mercury is the unit for blood pressure measurement. But penicillin, we use the unit is called unit. Example here, when you work in a hospital, you can see look like this. K-tab, potassium chloride extended release tablet form. But this tablet contains 10 milliequivalent. It is the unit. Or we can write 750 milligram. This is the different unit. Like here, potassium chloride saline solution. This saline solution contains 40 milliequivalent potassium, right? It is the unit for potassium. saline solution. So potassium dissolved in a water with other electrolyte. Conversion. Conversion between matrix unit. The matrix system is a decimal system. Therefore, conversion between the unit in this system can be done by either divided or multiply by 1000 or by moving the decimal point 3 places to right or 3 places to the left. So in a matrix system, to convert larger to smaller, multiply 1000 or move decimal point 3 places to the right, or example 1 gram equal to 1000 ml. So when the big unit convert to smaller unit, we multiply. If the bigger unit turn to the small unit, multiply, but if small unit turn to the bigger unit, we have to divide it. So to convert smaller to larger, divided by 1000, move to the decimal point. Conversion between household and matrix system. So conversion between the matrix and household are equivalent or not equal, right? Conversion to equivalent measurement between system is necessary when medication prescribed is written in one system but medication level is given another. So when we calculate any doses, to use the formula, all unit must be in the same unit. Like something is in gram, other is milligram. So gram must be converted to milligram. So it will be when in the same unit, then you go for the next calculation. So medication are not always prescribed or prepared in the same system to measurement. Therefore, it is necessary to convert the unit from one system to another. And calculating equivalent between two systems may be done by using the method of ratio or proportion. So what we learn up to now, conversion is the first steps in the calculation of doses. So in NCLEX board, when you go to solve any mathematical calculation, your first priority to check the unit. Is it same unit or not? If it is same unit, you are lucky, just go and calculate. But if it is not same unit, you have to conversion. So conversion is the first steps in the calculation of doses. Like here, medication label will usually contain both in generic name and trade name of the medication, right? So always check the expiration date on medication tab. So when you ready to push this medication to the patient, we must check the content, the volumes, prescription, and expiration date of this medication. So next here, so medication prescription, the name of medication is written first, followed by the doses, route, frequency. And it is depends on frequency of prescription, time of administration are usually prescribed by the healthcare agency and written in agency policy. Medication prescription must be written and using accepted abbreviation, symbols, but appropriate abbreviation and symbol must be approved by the Joint Commission. If the nurse has any questions about or see inconsistency in the written prescription, the nurse must contact the person who wrote the prescription immediately and must verify the prescription. So now here we can see the different form of medication, like oral medication. So tablet contain an independent mark to be used to breaking the tablet into the partial doses if needed. When necessary, the tablet can be divided into halves or quarter. We must use the tablet cutter or pillar, look like this, right? We divide it into two. So enteric coated tablet. So some tablet is layered by thin layer. So this is the color coat, acid resistant coat. So when this medication in the stomach, acid does not destroy it. Maybe the medication have to work in our small intestine or large intestine. So it will be protected by acid secreted by the stomach. So you see the pantoprazole enteric coated tablet. So the tablet is covered by enteric coated. Is the and here in this picture active ingredient here. Then the first layer is acid resistant. It is resist acid in the stomach because acid. This medication maybe work in my large gut. Example, and also coated outer layer. So enteric coated tab and sustained release capsule delay absorption until medication reach the small intestine. This medication should not be crushed out. Capsule contain a powder or oily medication in a gelatin cover. So this is the capsule. Inside this capsule, the granules, and this capsule is called gelatin. And this is the strip. Oral liquid are supplied in solution form and contain a specific amount of medication in a given amount of solution. Next, the medicine cup. This is the medicine cup and this is the dropper. So medicine cup has capacity 30 ml. We called ounce, and 1 ounce equal to 30 ml. Medication cup is calibrated, means numbering is there. The pure measurement place the medicine cup on a level surface at your eye level and then pour pure the liquid while reading the measurement mark. Volume of less than 5 ml are measured by using a syringe specially designed for oral administration. A calibrated dropper is used to giving medicine. This is the calibrated dropper. So parental medication. So if any medication we give them any route except mouth, we call parental. So parental always means injectable route, or parental medication are admin by intravenous, intramuscular, intradermal, or subcutaneous, like insulin, heparin, intramuscular, like morphine, and IV as well. So parental medication are packaged in a single dose we call ampoule or rubber stopped vial. So this is the vial and this is the ampoule. Usually ampoule contain the solution, but vial contain the powder form. And before use, we make it liquid with a mixture of distilled water. So the nurse should not admin more than 3 ml per intramuscular injection site or 1 ml per subcutaneous injection site. Larger volumes are difficult for an injection site to absorb and, if prescribed, must be verified. So in this picture, we can see total parental nutrition. Usually we use the subclavian arteries, right? So total parental nutrition we use for the patient who are not able to take the food through the mouth, right? And still, if your patient need the nutrition, we give them total parental nutrition. So total parental nutrition mostly marked with a dextrose. Okay, so this is the subclavian. It is not a artery, it is the vein. So total parental nutrition goes through the vein, like subclavian vein or internal jugular vein. So who need total parental nutrition? Who gets to internal intestinal system not functioning properly. So like your patient undergo to the total parental nutrition, what are the lab values you have to monitor? You should monitor the blood glucose level every time, right? It is very important for NCLEX board. So here showing the parental nutrition, but peripheral line. This is the central line, and this is the peripheral parental nutrition. So a common question sometimes asks, why we need total parental nutrition or total peripheral nutrition? So keep it in mind always. These two routes always follow IP line. This IP line, we give medication, or we can give the chemotherapy or long-time antibiotic therapy use of it. Okay. So the most priorities for the patient who undergo the parental nutrition is the prevent the infection, because infection is most common to attack. If I ask you how we prevent the infection, simply hand washing. And before to all of the procedure for peripheral nutrition or total parental nutrition, we have to use the antiseptic solution around the incision line or central line. Always we have to check the dressing as well. So now here, the parental medication, the standard 3 ml syringe is used to measure most injectable medication, right? 3 ml. So simply 1, 2, and 3 ml. This syringe is filled by drawing a solution until top ring to the plunger. This is the plunger, this one, and this is the needle. Everybody know. So always question and verify if excessively large or small volume of medication. Like I said, you are LPN or RN, you are going to push the medication. So if you see the medication dose is too small or medication dose is too huge, excess amount, it is good to hold it. Check the prescription, talk to the healthcare provider, make sure you are okay, you are right to push the medication, because it is our principle not too harmful for the patient. What else? Parental medication, the medication cartridge slips into the cartridge holder, which provide a plunger for injection to the medication. So pre-filled medication cartridge to be used once, and we should discard it. So if the nurse is to give less than full single dose provided, he or she needs to discard the extra amount before giving the client the injection. Always read the instruction with commercial medication. Then what next? So this one is called pre-filled syringe. Like you are diabetic, you are going to travel somewhere. It is good to use the medicine like this. So you used, then you discard. It's called pre-filled syringe. Dual chamber cartridge or pen, in pen. So parental medication. So in general, the standard medication doses for adult are to be rounded to nearest length. So if the measure milliliter scale, for example, 1.28 ml, it is good to round it to 1.3. So if you miss this point, it would be 128 ml. If you mistake this point, if you do wrong, you push the patient 128 milligram. But if you miss this point, you only put 13 ml. It is not that much danger if you push 128 milliml. So just avoid this type of error. It is good to put the rounded figure. 1.28, it is 1.3 ml. And always we follow the agency policies about the round medication doses to avoid the error. When volumes is more than 3 ml are required, it is good to use 5 ml syringe. So 3 ml you can use for 1 ml medication. But if patient need 3 ml, better to use the 5 ml syringe. Here showing here tuberculin syringe. So tuberculin syringe is 1 cc. You see, this is the look like this. So hold the total capacity in 1 ml. Used to measure small or critical amount of medication, such as vaccine or child medication. And it is calibrated. This is the calibrated in a milliliter, which is 1/10.1 mark on a metric scale. And insulin syringe. So the standard unit is 100 insulin syringe is used to measure unit 100 insulin only. So insulin should not be measured in any other type of syringe. So only we use the insulin syringe. So if the insulin prescribed state to admin regular and NPH insulin, combined both type of insulin in the same syringe. So when we mixturing two different type of insulin in the same syringe, used to memorize RN, R for register and for nurses, register nurses. But RN here are for regular insulin and for NPH insulin. So regular insulin we have to withdraw first and then withdraw NPH insulin. Easy way to remember RN, regular insulin first, then N stand for NPH insulin. So here showing to insulin and insulin vial lentas long-acting insulin and also Novolog insulin S-part short-acting insulin. And this is the insulin syringe.